Welcome to the video about thalassemia, a genetic disorder that affects the production of hemoglobin. Thalassemia is a genetic disorder that leads to anemia and affects the production of hemoglobin. It is commonly found in individuals of Mediterranean, African, Middle Eastern, and Southeast Asian descent. Thalassemia is an inherited genetic disorder that affects the production of hemoglobin, a substance found in red blood cells. Different forms of the condition occur worldwide. Thalassemia is caused by the body's inability to make hemoglobin, the protein in red blood cells that carries oxygen. People with thalassemia have fewer red blood cells and less hemoglobin, leading to anemia and related health issues. Thalassemia can lead to anemia, a condition causing tiredness and shortness of breath. The severity of the condition can range from mild to life-threatening. Treatment options for thalassemia often include blood transfusions and medications. In some cases, a bone marrow transplant may be necessary. Treatment options for thalassemia often include blood transfusions and medications. In some cases, a bone marrow transplant may be necessary. Thalassemia can lead to anemia, a condition causing tiredness and shortness of breath. The severity of the condition can range from mild to life-threatening. Thalassemia can lead to anemia, a condition causing tiredness and shortness of breath. The severity of the condition can range from mild to life-threatening. Treatment options for thalassemia often include blood transfusions and medications. In some cases, a bone marrow transplant may be necessary. Treatment options for thalassemia often include blood transfusions and medications. In some cases, a bone marrow transplant may be necessary. Thank you for watching this informative video about thalassemia. Remember to consult a healthcare professional for personalized advice.
Foods to limit. If you're looking to maintain or improve your blood health, it's important to focus on a balanced and nutritious diet. Here are some dietary recommendations to consider. Sodium and processed foods. High sodium intake can lead to high blood pressure, which is a risk factor for various cardiovascular issues. Limit your consumption of processed foods, fast food, and heavily salted snacks. Added sugars. Excess sugar consumption can contribute to weight gain, diabetes, and other health problems. Limit sugary beverages, candies, and foods with added sugars. Saturated and trans fats. These fats can raise your cholesterol levels and increase the risk of heart disease. Limit fatty cuts of meat, full-fat dairy products, fried foods, and commercially baked goods. Red and processed meats. Diets high in red and processed meats have been associated with an increased risk of heart disease and other health issues. Choose lean protein sources like poultry, fish, legumes, and plant-based options. Alcohol. Excessive alcohol consumption can negatively impact your liver and overall health. Limit alcohol intake to moderate levels, following recommended guidelines. Caffeine. While moderate caffeine consumption is generally considered safe for most people, excessive caffeine intake can lead to issues like elevated heart rate and blood pressure. Be mindful of your caffeine consumption from sources like coffee, tea, energy drinks, and sodas. High glycemic index carbohydrates. Foods with a high glycemic index can cause rapid spikes in blood sugar levels. Limit white bread, sugary cereals, and other refined carbohydrate sources. Opt for whole grains and complex carbohydrates instead. Excess vitamin K. If you're taking blood-thinning medications like warfarin, you may need to limit your intake of vitamin K-rich foods, as they can interfere with the medication's effectiveness. These foods include leafy greens, broccoli, and Brussels sprouts. Salt substitutes. Some salt substitutes contain high levels of potassium, which might be problematic for individuals with certain health conditions. Consult with a healthcare professional before using salt substitutes. It's important to note that individual dietary needs can vary based on factors like age, health status, and medical conditions. If you have specific concerns about your blood health, it's a good idea to consult with a registered dietitian or healthcare provider to develop a personalized nutrition plan. Tips for the health of the types of blood? There is limited scientific evidence to support the idea that specific diets or health practices should be tailored to blood types. The concept of blood type diets is not widely accepted by the medical community. Instead, I'll provide you with general tips for maintaining good health, regardless of your blood type. Balanced diet. Focus on a well-rounded diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. This approach supports overall health and provides essential nutrients for everyone. Hydration: drink plenty of water throughout the day to stay properly hydrated. Regular exercise: engage in regular physical activity to maintain a healthy weight, improve cardiovascular health, and boost your mood. Sleep: prioritize quality sleep, aiming for 7 to 9 hours per night, as sleep is essential for overall well-being. Stress management: practice stress reduction techniques such as meditation, deep breathing, yoga, or mindfulness to manage stress effectively. Avoid smoking and limit alcohol. If you smoke, consider quitting, and consume alcohol in moderation. Regular checkups: schedule regular health checkups with your healthcare provider to monitor your overall health and catch any potential issues early. Vaccinations: stay up to date with recommended vaccinations to protect yourself from preventable diseases. Mental health: prioritize your mental well-being through social connections, hobbies, and seeking support when needed. Avoid fad diets: be cautious of any diet or health trend that promises dramatic results based on your blood type. Always consult a healthcare professional before making significant changes to your diet or lifestyle. Remember that individual health needs can vary, and it's important to consult with a qualified healthcare provider before making any significant changes to your diet or lifestyle. They can provide personalized guidance based on your unique medical history, needs, and goals.